some house cleaning details and introductions. If you're just joining us, welcome to the CDC National Healthy Worksite webinar. We're going to wait just a couple seconds to let everybody join. All right. We still have some folks coming into the webinar. We're going to give them just a minute or so. All right, we'll go ahead and get started with some house cleaning or housekeeping. Again, this is Brenda Schmidt. I'm the president of Meridian Health Management. Welcome to the CDC National Healthy Worksite Training and Technical Assistance webinar. We have over 1,000 registrants signed up for the webinar. We very much appreciate your interest in this program. The webinar slides will be posted to the program website next week. If there are other individuals in your organization that missed this webinar, the program website and the program mailbox will be shown at the end of the presentation on a slide, so you can jot that down. We will have the opportunity for questions at the end of the presentation, so if you type a question into the question box, it will be captured, and we will have a list of all questions that you type, and then we will answer some of those as they come through at the end of the webinar with the time available. If you attend this webinar, you will receive future communications about the National Healthy Worksite Program. However, if you visit the program website, you can provide your contact information to express your interest in future training opportunities and other important program notices affiliated with the National Healthy Worksite Program. Since you are captured on this list by virtue of registering for this webinar, if you prefer not to receive future notices, you can also send an email to the program mailbox, which again will be displayed at the end of the webinar, if you prefer not to receive notices in the future. All right, well, before we get started, I'd like to introduce our speakers. Our first speaker will be Jason Lang from the CDC. Jason is the team lead for workplace health programs, where he has managed projects and provided leadership for the CDC National Center for Chronic Disease Prevention Workplace Health Initiative since 2007. Our second speaker will be Andy Spalding. Andy is with Meridian Health Management. He is the director of the Meridian Center for Community and Worksite Health, and a critical function of this center is to work closely with the CDC and other Meridian staff to ensure that employers, wellness providers, public health agencies, brokers, and employer groups use the outcomes from the National Healthy Worksite Program to extend efforts to improve the health of employees nationwide. Andy Spalding and Toy Williams have been serving as the team leads on the National Healthy Worksite Program Training and Technical Assistance Committee, and they are coordinating the community and national training efforts throughout the program. Toy Williams is a consultant to the CDC on the National Healthy Worksite Program. She has over 10 years of public health experience, including several health and wellness programs and initiatives focused on community-oriented primary care, chronic disease, and a broad range of community health education and outreach initiatives that focus on basic mechanisms of human health and disease. So without further ado, we'll turn it over to Jason to get started on the webinar.
Thank you, Brenda. Good afternoon, everybody, or good late morning for folks that might be tuning in from the West Coast. And welcome to our webinar that will provide you an overview of the training and technical assistance opportunities that will be a part of the National Healthy Worksite Program over the next 18 months or so. Okay, today's agenda. We will cover real quickly a few slides on the overall National Healthy Worksite Program for folks who might be tuning in to one of our webinars for the first time, just to orient you to what the broader program involves, and then the rest of the presentation will really begin to provide some context and framework for how we are going to train employers and interested organizations around workplace health topics for the remainder of 2012 and much of 2013. The National Healthy Worksite Program started on October 1st of 2011. It is a CDC-led initiative. We are principally working with two main organizations for implementation and an evaluation of the program. Viridian Health Management will be our prime program implementation contractor, and the Research Triangle Institute International will be leading the national evaluation of the program. The National Healthy Worksite Program will establish and evaluate comprehensive workplace health programs to improve the health of workers and their families. It's designed to assist employers in implementing science and practice-based prevention and wellness strategies and lead them to specific measurable health outcomes, principally focused on the reduction of chronic diseases. Chronic diseases for most employers, including heart disease, stroke, cancer, obesity, and diabetes, are among the most prevalent, costly, and most importantly, preventable of all health problems. So by focusing on those health risks and conditions within the National Healthy Worksite Program, we really hope that we can assist and aid employers in improving the productivity and contribution to these employers' overall competitiveness. The goals that we've outlined for ourselves within the National Healthy Worksite Program, as I said, will focus on the reduction of risk from chronic diseases among employees. We also will be capturing a lot of process and outcome evaluation information, principally using the RE-AIM framework, and we hope that this will help us better understand sustainable and replicable practices so that the efforts of the employers who are participating in the program can be continued after we are done working with them formally, and also that we can make available to employers outside of the program or organizations who work with and support employers in workplace health, make the practices, tools, and resources and learnings from this project available to them as well. And really our first opportunity to describe those opportunities to you will take place today on the webinar. We are also interested in promoting peer-to-peer business mentoring among the employer community. We feel that the participating employers that will be involved in the National Healthy Worksite Program will have a lot of experiences and stories to be able to share, and they can be able to do that through a number of opportunities and forums with other employers who may just be starting out on their workplace health activities. They may be grizzled veterans at doing workplace health promotion, or they may be organizations who, again, are working to support employers in a number of different various capacities. And so, again, I think through the training and technical assistance program that we'll outline for you today, you'll have a better sense of where some of those connection points may be, and depending on what kind of organization you are, where you might be able to best intersect and integrate with what we're doing. The National Healthy Worksite Program will formally involve 100 employers from across 7 different community sites. This group of 100 employers will be roughly broken out in equal numbers in 3 different size categories. We will have a small employer group, which will consist of public and private employers with less than 100 employees. We will have a mid-size employer group, which will contain employers with 100 to 250 employees, and we will have a large employer group, which will include employers that have more than 250, but no more than 1,000 employees. Now, we did make an accommodation during our recruitment process that larger employers could nominate a specific work site to participate in the program, as long as that individual work site with which the National Healthy Worksite Program would be focused did not have any more than 1,000 employees as a part of it. So we may ultimately have some organizations that represent companies or employers that have many more than 1,000 employees. And these 7 different communities, which I'll show you in a minute here, will each have a group of the participating employers, somewhere between 10 and 15 individual employers will make up the program participants in each of those 7 different communities. The community sites where the program will take place are listed here on this slide. The process with which we went to select these sites, which were announced back in January of this year, was to look at 2 main criteria. One was the disease burden for chronic diseases and their risks that, again, are the main focus of the program. These data were reviewed and came from a number of different national data sets, and all were reported on a county level, because you will see that all the program sites do represent a county level kind of unit. And the second main criteria was to look at communities that had some existing infrastructure and capacity around health promotion, disease prevention. That capacity could come from CDC-funded programs. It could come from other government-funded programs at the national, state, or local level. It could come from academic universities or nonprofit organizations. But what all of those programs, initiatives, or projects had in common was that they did focus on one or more of the main priority issues we're addressing within the National Healthy Worksite Program, and that we would be able to reach out and connect with them with the hopes of providing some synergy and integration with the employer participants that we will enroll into the National Healthy Worksite Program, all with the eye on trying to improve the ability of these employers to sustain their efforts long-term after we are finished with them at the end of 2013. Specifically, just for a moment, in terms of what's involved with building that comprehensive workplace health program, in the National Healthy Worksite Program, all of the 100 employers who will be participating will go through a full program development life cycle process. We will start with some engagement meetings and kickoff meetings, but once we get into the nuts and bolts of helping them establish their program, it will all start with a baseline assessment, which will operate at both the individual employee as well as the organizational employer level to look at needs, interests, health risks, and existing capacity with respect to health promotion programs, policies, environmental supports. Once we get that information back and can share it with the employer and the employees, we'll undertake a planning process, the result of which will be a 3-year workplace health improvement plan, which will really guide the worksite through the remainder of the program development life cycle, as well as provide activities, objectives, and goals for the employer to work through long after the formal National Healthy Worksite Program ends. The implementation process will involve actually standing up and allowing employees to directly participate in a number of programmatic, policy, and environmental support activities, again, all with an eye on lifestyle risk factors, particularly physical activity, nutrition, and tobacco use. Kind of underlying all of these different stages of development is building a program infrastructure within each of the participating employers, again with an eye on long-term sustainability. So some of the elements of this infrastructure will include multidisciplinary healthy worksite committees, identifying program champions at all levels of the organization, but most especially at the senior leadership level, and then reporting and engagement, again, at all levels, but making sure that we have a focus on getting the commitment, engagement, buy-in, and visibility of the leadership in each of these organizations to promote, market, and reinforce what we're trying to do. Participation in program activities such as training and technical assistance. You'll get a much better sense for the direct program participants what this will involve today. And then I think you'll see that folks outside of our group of 100 will have many of the same opportunities available to them as we go forward in time. And then we'll end the life cycle process with an evaluation, again, at the individual and organizational level to see what changes we were able to observe in terms of organizational culture, individual employee health, risk, and behavior, as well as some economic indicators related to productivity and absenteeism. So then, just to give you a high-level overview of the training component, we will be providing training and assistance to employers on developing these comprehensive healthy worksite programs. The curricula will largely map to the life cycle process that I just described. The intention of doing this training is to develop knowledge, skill, and capacity within the employers so that we are not simply coming in and doing everything for them, and then once we are done, the employer slowly reverts back to a baseline state and does not know how to provide for the long-term sustainability of the program. So it's critically important for us that the development of knowledge, skill, and capacity is executed probably even more so than the individual program elements like putting a policy in place or conducting a health assessment will be. This training component will also give us the opportunity to encourage social support, not only among the employers in the program, but with other employers and organizations from our 7 community sites, as well as opportunities to engage, network, and talk with employers and experts from around the country. And then lastly, I think it's wonderful for today's purposes, all of the interest we had in this webinar, and we hope that you'll walk away from this at the end of the presentation with a good sense of how you can engage. We pretty much recognized from the get-go here that the supply we had available based on our ability to work intensively and directly with employers was going to be limited, both in the number of places we would operate as well as the number of employers who could engage. And so we designed from the very beginning, and you'll hear about shortly, a opportunity to extend what we are doing in the National Healthy Worksite Program to other employers so that they too will have the opportunity to build some of the knowledge, skill, and capacity that we plan on doing with our formal program participants. So at this point, I'm going to turn it over to Andy Spalding, who, as Brenda mentioned, is coordinating a lot of the training elements of the program, and he's going to walk you through a little more specifically what's involved with the training and technical assistance planning.
Thanks, Jason, and hello to everybody out there. bring up these slides. So if you missed Brenda's introductions, I am Andy Spalding, and I work for Viridian Health Management, and I'm the director of the Viridian Center for Community and Worksite Health. So what I'll do in the next few minutes, and what really we'll do for the rest of the presentation, is to provide some more detailed information, as Jason said, on training opportunities and goals, details on the training curriculum that we're utilizing for all participants, and specifics on community level trainings and national level trainings as well. So we actually we're quite fond of this slide. We even considered doing the entire presentation built around this slide. It just seemed like it would be a little bit boring, but there is a lot going on here, and it really says a lot, I think, about our approach to training. And so thought I'd at least comment on those three rightmost columns that show the various gradients, and I think it's really important. So with REACH, when we look at the four boxes on the left that I'll describe in just a minute, from program participants down to the topic-based webinars at the bottom, we really are offering a variety of training opportunities from local level in each of the 7 National Healthy Worksite Program communities, all the way to the national level programs for everybody, any employer or any agent or facilitator who works with employers. And on the intensity gradient, it's pretty important to point out here that a theme here is that with program participants, they are going to get an intensive level of support in terms of the program implementation they get, whereas the national level participants, that's going to be more information based. And the responsibility, we work very well as partners. As Brenda said, Toy and I team up to lead the Training and Technical Assistance Committee. And so, those arrows, if you will, that go up and down reflect that Viridian will really handle the oversight and the administration of community level training. CDC will do that with national webinars, but we are really hand in hand working on this. So if we go down through the 4 boxes on the left in the training type column, we can start to answer who are the trainings available to, what trainings are available, and where and when are these trainings available. And so I thought I'd make a few comments about each of these sections. I think it'll make it more clear, and it'll set us up to go into a little more detail later. So starting with program participants, these are, as Jason described, the selected 100 employers across the 7 communities that will receive intensive on-site support really around building comprehensive and very sustainable worksite health programs. So as I described, these program participants, as we refer to them, receive the most intense experience that actually consists of mandatory participation in the formal training, along with the hands-on, on-site assistance with the implementation of the core worksite health program. Community participants, on the other hand, they are also local. They are either in or they could be near within travel distance to one of the selected National Healthy Worksite communities. There are employers who are interested in participating in local trainings, what we're calling Worksite Health 101, on program implementation and support. So community participants will have opportunities to participate in 4 very detailed Worksite Health 101 sessions, as well as these supplemental, really roundtable meetings where we'll discuss and support them on things like program implementation, providing peer networking opportunities and idea sharing, definitely on identifying and connecting them with community resources, as well as program sustainability. I'll say more about those forms and what they look like in a little bit. And then the third box there on national participants, these are really all employers and organizations nationwide who are interested in participating on webinar trainings on program implementation. And I should have said at the outset, for all three of these levels of participants, we are using the same curriculum. It's the intensity of how that's delivered, or rather the intensity of the follow-up support they receive that varies across all levels. With national participants, so we'll offer the Worksite Health 101 curriculum to them through national webinars, and then we'll be creative and do the best we can to provide follow-up calls that allow as much as possibly can happen on a webinar type call that allow some peer networking, some follow-up support. And then lastly, all participants, so program, community, and national, will be invited to attend special healthy worksite topic-based webinars. So these may range from aging in the workforce to the integration of safety and health promotion. And they're going to be national webinars, informational sessions on a variety of subjects delivered by national subject matter experts. So, whether you're a program participant, community, or national, you're not going to be required to participate, but it's very likely that some of these topics are going to particularly grab your attention. You'll be very interested in learning information that might influence what you decide to put in place at your work site. So before I move on, one real key thing we're excited about, we feel strongly about, is no matter what level of training employers participate in, they'll walk away with detailed checklists of items that clearly explain action-oriented strategies that they can do when they get back to their work site. So we feel really moved to ensure that all levels of training really help an employer take their program to the next level. In terms of the training audience, the Worksite Health 101 is really geared towards people at the worksite who are able to take action. So most likely this will probably be human resources staff or healthy worksite coordinator or committee members. At many organizations, certainly these are referred to as wellness teams or committees or safety teams or blended health and safety teams. And so those are very likely candidates to attend. We expect at smaller employers, usually the business leaders of a smaller organization are the jack of all trades. The CEO is also the accountant and the janitor, and sort of the Jack or Jill, I suppose, of all trades. And so could be that business owner as well. And then we think there's a really high level of value also for facilitators. So these could be local public health department staff, community-based organizations, chambers or other business coalitions, and definitely health insurance brokers. I think all across the country we've seen brokers more and more being, at a minimum, facilitators of getting employers to at least consider developing worksite health programs, and at a maximum, really actually introducing them to strategies and resources that help them take action. Our training goals are three, and they're quite straightforward. One, to provide forums that improve knowledge, skills, and capacity, and that these forums support the building and the sustaining of healthy worksite programs. Related, I think, is peer networking, and that's really important to us. I think I'm sure I might be visioning 500-something or more heads nodding out there when I say that one of the most powerful things that happens when we get a lot of employers together sharing their successes, their challenges, is that peer learning seems to be so powerful and often results in connections that last. So that's really important to us, to connect employers with each other, to connect community participants with program participants. That's big, and as well as connecting them with community resources. And then on the sharing of information, tools, and resources used with program participants in the implementation of the National Healthy Worksite Program, we fully intend to share those tools and those resources, as well as sharing the other credible public domain tools and resources that are already available, and maybe employers just at the moment. I've already mentioned the training curricula is the same for all participants. Here are the key elements of our training curricula. I'll draw your eye to the third bullet. We follow the whole National Healthy Worksite Project follows the CDC's Worksite Health Model, and similarly our training approach does as well in terms of the assessment, of the collection of data, planning, implementation, and evaluation, the way that we go about that. I'll draw your eye to the last two items here that are, I think, particular strengths and particular focus of the project, which is to spend a lot of time and energy on building a culture of health. And we know that without supportive leaders, without a culture that supports positive health, positive behaviors, lifestyles, this work is much more difficult. And then lastly, and long time coming, this project really embraces the integration of safety and health promotion, and I think that's critical. This continuum is really a different expression of the training curricula, and we presented it this way because it shows that there's a continuous improvement or an iterative type process to our training. So I mentioned that we'll offer the 4 Worksite Health 101 programs, and the reason for breaking them out and separating them is so that after we've in group settings done skill building and sharing of information and resources, that employers will go back to their sites and have a chance and have time to think about putting these pieces in place, whether it's the design of a health and safety team or worksite health team, whether it's identifying what data collection or what data sources they can collect at their worksite. Whatever it is, our model is allowing time for employers to go back to the worksite, start to put those things into place, and come back and be able to share again challenges and successes and learn from others, as well as to have opportunities to learn from our staff on the ground in the communities, which includes community directors and health coaches. The training benefits, I think, are a pretty natural extension of the curriculum that I just showed on the previous slide. So we designed the curriculum so that it really will maximize the likelihood that participants build systemic, comprehensive, and sustainable worksite health programs. Jason talked about that at the end of his remarks, that is one of the most important things for us to do, is to teach each of the employers involved, whether program, community, or national level, to teach them how to build it for the long haul. In reality, we know that program participants are going to implement the full comprehensive model. They have the on-site support. They will implement a full comprehensive approach. Whereas community and national participants, on the other hand, in some cases, success may be defined as they identify key priorities, they develop a plan, but they might not have the resources in-house to fully take action on that plan. Or maybe they just need to start small and they need more time to build their program. It's a little bit of a closer look at what's offered or what's provided with program participants. So again, these are the 100 employers across the 7 communities. And looking at the what here, program participants receive the intensive on-site support that includes the formal healthy worksite training, and they get full assistance around program implementation. So in their case, that might look like, or is going to look like, community directors providing hands-on assistance in the collection of data, the identification of key priorities, pulling together a detailed work plan that's a match with the particular organization's needs and priorities, defining well-written goals and objectives, and really supporting the full implementation and even evaluation of those interventions, of that work plan. So you can see this is delivered in person by community directors and also offered concurrently with community participants as part of these, what I've called Worksite Health 101s that happen as sort of a collection or a community network. And for program participants, this is mandatory, their participation in the Worksite Health 101 training. And I've already covered that this is happening via 4 Worksite Health 101s and 7 monthly roundtables that we think are going to be critical in supporting the program development and sort of evolutionary process, if you will, over a period of 12 months. Looking at a similar slide, but for community participants, the big difference is this level of support provided. So community participants will not receive the on-site support that program participants get, but they will get group-level training and support related to program implementation. So for them, that could look like they participate in these community sessions, perhaps related to data collection and developing a worksite health plan, among others. Through that, they identify key priorities from the data that they're able to collect, which that's even going to vary considerably from employer to employer, and they begin to develop strategies for their worksite health plan. So they may come to one of the trainings or one of the follow-up roundtable sessions, and that time spent with peers, sharing their plans, discussing their challenges, and getting input from both peers and community directors will be really critical and important, and the level of support that we'll be able to provide to help them get on the path toward a sustainable, comprehensive program. And then one of the things I am most excited about is doing this work through a community network that's created through the National Healthy Worksite Program, and particularly is pulled together through offering the Worksite Health 101 trainings in communities. So we're partnering with stakeholders. We're certainly inviting a large group of employers to be a part of this. And I think from these sessions, my biggest hope is that some sustainable, for lack of a better word, structures are formed. So maybe that looks like the creation of some type of council or an initiative that's based at a chamber, or a YMCA, or a local public health agency. It might not even be a very formal type of organization, but that unit or that coalition could leverage the experiences of the National Healthy Worksite Program and really support the adoption of healthy worksite programs by more employers in the community, and particularly by smaller employers who are so difficult to get to the table. And I think we know enough now to know that just teaching a small business about the key principles of building a comprehensive worksite health program won't do it. It won't do it. But by pulling together a community model that can help them and then ultimately allow them to expose their workers to a comprehensive set of approaches, I think that really has a lot of promise. So with that, I'm going to transition over to Toy Williams, and she is going to walk you through the national opportunities available. Thank you.
Thank you, Andy. Okay, so following up with where Andy left off with the participants, the CDC will offer training or webinar trainings to any employer or organization that cannot physically attend an on-site training session as a program or community participant. So here we're talking about our national participants. You'll be able to join our 90-minute quarterly training webinars, We will have CDC staff and national experts providing the training and resources that follows the on-site curriculum to implement a worksite health program in your own organization. So since this is open to organizations nationally, these trainings will cover organizations and resources on a broad spectrum. So we won't be focusing so much on a community resource or a regional resource or a local resource. It's going to be more universal. These trainings are a series, therefore it's best to attend all sessions to get the full benefit. It won't be much of a benefit if you attend the data session, but you didn't understand what assessments you needed to do in order to collect specific data. So it's really best if you attend all of them. We will be covering assessments, planning, implementation, and evaluation. This participation is voluntary. Again, it will be offered on a quarterly basis, and we are scheduled to begin these sessions in June, or on June 18th, and I will show you the link to register for that before we close today. We will be offering special interest topics for the workplace that will be covered quarterly as well. Now, these topics are complementary to training modules and will follow approximately 1 month after each training session. So, for example, the first on-site training will be making the case, leadership, and data review. One of the aspects of data that we will be covering is demographic data, which includes age. So the first special interest topic that we will be presenting is the aging workforce population, which relates back to demographic data. These sessions are independent of one another, but again, we do encourage your attendance since they are in relation to the training sessions that we will be covering. We will have subject matter experts providing action steps for these issues like aging in the workforce and community partnerships. These 60-minute webinars are open to participation by any group that we've discussed today. So that includes our program participants, our community participants, and the employers and organizations nationally that would like to be involved. These are scheduled to begin in July, and we will send invitations to register for this starting very soon. As Jason mentioned earlier, we will be evaluating program participants to determine the successes and barriers that they have encountered. The information that we gather, such as the importance and utility of information in the action steps, will be shared with those that are not involved in the program. And we will share some of this information on our training sessions, and it will also be shared on our website as well. One way to participate is to check our program website. Here we have a snapshot of our home page. This is what the page looks like currently, where you can sign up for email distribution lists, for announcements and training dates and times. And this is for any location who would like to sign up. Anyone can sign up for that. That would be listed under our featured items that circles the big circle. Or you can contact a community director if you are located in one of the National Healthy Worksite Program community sites that Jason mentioned earlier. And that's under the little circle toward the lower right part of the screen. You see there where it says Community Sites Contact Info. You can contact your community director if you are in one of those locations. But again, you can sign up as any participant can sign up for our email distribution list to get announcements and dates for our events. The website is currently being used for basic announcements and dissemination. We most recently used it for the National Healthy Worksite Program certification process, which is now closed, but we did use it for that to gather all that information. The launch of redesign will occur before our trainings begin, and at that point, it will transition to a clearinghouse and contain information such as the National Healthy Worksite Program assessments and evaluation tools, We'll be sharing success stories from program participants that are involved in the program. We'll be sharing local resources and inventory, and we will also be sharing things such as our opportunity announcements. There are several ways that you can stay connected to us. One way, of course, is through our program website that we've just mentioned. And the link is here, www.cdc.gov/NHWP. Here we will have a calendar of events, updates, resources, and general connections to the program. Now, if you are not currently registered, we please encourage you to log on here to do so in order to stay connected to the program. We also have an email address where you can email us with any questions or inquiries, and someone will get back to you as soon as possible. You can get to this email address from the program website as well. And we do have a LinkedIn account available for you to sign up. It'll be more useful and more active moving through the program and the training processes, and this is to create more peer-to-peer networking, connections, and discussions. And finally, we do have an upcoming event on the National Participation Program Implementation webinar. We will be covering our first of our 5-series training session called Making the Case in Leadership. That will be on June 18th at 1 p.m. Eastern Time, and we have our featured speaker, Mr. Bill Bond, who we are thrilled to have joining us for this training session. He is a nationally recognized expert with Wellness Champions, and we are just enthusiastic about him participating with us on this training session. We do have a link for the registration that you can sign up for. And this, again, is the first of our 5 series in our training. We will be sending an update for this soon as well, so please keep an eye out for that. And right now, I'm going to send it back to Brenda.
All right. Thanks, everyone. And thanks for your questions and, again, interest in the program. We did have quite a few questions come over. Some of those are more housekeeping in nature, so I'll address those first. Several of you asked if the slides and the webinar would be posted to the program site, which, yes, it will. And, Toy, it might be helpful to go back to that slide that has the program website and email box on it, in case people missed that. Perfect. Thank you. And then also has a request to send out as an email a reminder when those are available on the website. So we will send out a reminder to everyone who attended the webinar when those are posted, so you can go pick those up at the website. And this presentation and all future presentation and slide decks are certainly available for folks to use as talking and training in their own communities as part of this program. So that was a question that came up as well. Jason, I have one for you. Someone mentioned that Andy said that it was clearly focused on the integration of health promotion and injury prevention, and the question was, how is this integrated with NIOSH and their Total Worker Health Program?
Yes, thanks, Brenda. Yeah, every step along the way, we are looking for opportunities to take what folks do in the health promotion realm and what folks do in the occupational safety and health realm and merge and integrate those things together. So starting from the very beginning in terms of putting a leadership and steering committee group for this program together, we have representatives from NIOSH involved at that level. When we talk about our partners in implementing or evaluating the program, we have obviously our great partners Viridian and RTI, but we also have the Center for Public Health in the New England Workplace, which is a NIOSH Center of Excellence. So the CPH-NEW group up in New England has been very involved with the development of our protocols, our instruments, and then as that trickles down into those protocols, instruments, actually the strategies that will be implemented, again, we are looking to simultaneously collect information, talk to people, educate people, and then provide opportunities for them to think about their health in a very holistic and comprehensive fashion. So they will get safety messages during their health promotion activities and vice versa. So that depending on where the individual employer is at the beginning of the program, certainly at the end they will have an appreciation and knowledge base around how to integrate those things. And frankly, we probably concede that most of the participating employers starting out in our program have a pretty good frame of reference when it comes to safety. There may not be a whole lot we can teach them there, but we hope we can leverage that and build on these other elements of our program so that, again, as we've talked about this last hour, we put people in the best position to be able to sustain what they're doing the long term.
Okay, thank you. Another question came over. How can I get involved in communicating community training opportunities to employers in my community? Andy, you want to take that one?
Yeah, so is there any detail as to whether it was the, I guess, so if that happens to be one of the 7 selected National Healthy Worksite locations, you know, we would really very much like to promote those. I think our website is going to be key for sharing that information. More than likely, I'm assuming it's going to be the national level training that anyone on this call could, and we hope you will, promote to your members, your constituents, any businesses in your community. It really will be through the program website. You'll find all the information. I think like what Toy is showing here, covered in terms of the the timing and the registration links and the specific descriptions of our training. It'll be from the sites themselves. And so what we'll do for each of our trainings is to make sure that we're writing up a well-worded description, a very concise description that would be easy for you to forward to again, members or employers in your community. We would love that.
Looks like we have several employers who certified themselves as being within one of the 7 program communities and expressed their interest in being considered for a program participant. So we did get a couple of questions. Have the work sites or the employers been selected for this program? The answer is no. And another question was, how does the employer know if they've been selected? So I think the first step of that is if you certified your business as being interested in becoming a program participant and you are located in one of those 7 communities, you will or should have already received a letter confirming that we did receive your certification through the program website. And then as we move through that selection process, you will be receiving a phone call if you received a letter. So again, if you are located in one of those communities and you didn't receive a letter or you are interested in becoming a community participant, I would encourage you to go to the program website and contact the community director that is located in your community. Each of the 7 National Healthy Worksite program communities has a full-time community director at this point, and their contact information is available from the website. So we did have another question, Jason. I think this might be a good one for you. Will the National Healthy Worksite program include engagement strategies for employers to use to reach families and include them in a wellness program?
Excuse me. Thank you. Yes. You know, the framework and model that we're using recognizes the fact that what employers do to create an environment while people are at work is a very crucial part of maintaining their overall health. However, we also recognize that people do not live at their job 24/7. They go back into their community, they go back to their families, they interact with friends and acquaintances. And so the extent to which employers can engage with that broader community to, you know, at a minimum, understand what the environment looks like, and at a maximum, formally partner and collaborate with other organizations in the community on broader health goals and initiatives is something that I think is going to develop, hopefully, through these training opportunities and through the roundtable discussions and other face-to-face forums that Andy was describing in terms of the program and community participants. So that, I think, is one way where the employees of a certain organization can have some of the learnings and information translate out to their families and spouses, dependents, and other folks. I think a lot of the direct health information, health education information that is either already developed and will be inventoried or will be created for this program, again, will be made available to a large extent through the program website. And things like that can then obviously be shared with not just the employees of a participating employer, but their families and dependents or other individuals from around the country. So I think that would be another opportunity. And then lastly, and probably most directly from an employer perspective, is how the health insurance plans that were a requirement for participation for our employers in many cases are going to cover spouses and dependents. So that will be, while not a formal intervention focus for us in terms of changing benefit design or getting certain clinical preventive services added to a package, again, through this on-site kind of intensive support that our participants will get, we feel there will be many formal and informal teachable moments where we can talk about things related to benefits, insurance, or other opportunities that might engage family members more directly as time goes on.
All right, thank you. I have another question on have the outcome metrics been defined at this point, or will it depend on what data employers are able to gather?
You want me to take that one, Brenda?
Yeah, that'd be great.
Yeah, we have set our overall program outcome goals and objectives. I think the only ones we presented to you today were some of them are related specifically to this training component. If you go back to our program website and click on either the slides or videos for the program overview presentation, you can get at a high level what those outcomes of interest for us are. We are finalizing and having reviewed currently all of our data collection instruments, which will cover all of the different specific metrics and indicators that will be a part of the program. And as part of the formal participation of the program, those things that relate to the organizational level for the employer will be required to be completed both at baseline and at the end of the program. And for the employee population, those instruments like a health assessment will be voluntary in terms of participation, but we have a lot of emphasis and energy going into engagement at all levels of the organization. So we hope through the number of strategies we'll employ once we get on site with employers, we'll be able to get a pretty high participation rate in those data collection activities, as well as all of the formal program opportunities once they're fully implemented.
Right. I think we're out of time, but just a couple of other things in response to several questions. This and, in fact, all other future training opportunities will be posted to the website, as will the presentations. So those presentations will be posted there. So if you miss a training opportunity moving forward, you can go to the website and download those PowerPoint presentations. Several of you provided email addresses with specific concerns. If you do that, we will certainly get back to you directly about those. And again, appreciate your interest and participation in the webinar today, and we look forward to your attendance at future opportunities as they become available. Thanks so much.
The organizer has ended the session, and this call will be disconnected. Goodbye.